When taking blood pressure, you want to make sure that your patient has been rested for at least 5 minutes before the taking of blood pressure. You want to make sure that they have not consumed any caffeine or nicotine 30 minutes prior. You want to make sure that the blood pressure cuff is placed over the bare arm. No long sleeves are permitted. Feet should be flatly on the floor and back supported, and arm elevated at a heart level. You got to make sure that the cuff is a proper size and that it fits well, not too tight or too loose, or you'll get wrong readings. Find the artery mark, which is labeled on a blood pressure cuff, with the patient's brachial artery. You want to line this up as best as possible so you get the best possible readings. You want to make sure that the cuff is placed tightly enough but not too tight. You want to make sure that the patient is comfortable. You want to take your blood pressure dial or meter and place it at the top of the cuff just so you can get a better view of the dial and the numbers. You want to make sure that your equipment is working properly, such as your stethoscope. You want to turn it and tap it to make sure it's on and make sure you can hear those sounds. After you've placed the stethoscope ear prongs in, you want to take the stethoscope bell and place it at the brachial artery line. You want to make sure that your equipment is working properly. Once you've done that, you want to turn the valve all the way right on your pump and pump all the way till you reach 180 millimeters of mercury. As you can see, the dial's going up. And once you've hit that number, you want to turn the dial to the left and release at a rate of 2 to 5 millimeters of mercury per second. These readings are your diastolic or your systolic and diastolic numbers. The first sound you will hear is a systolic sound, and the final sound you will hear is a diastolic sound. You want to make sure that the pressure isn't released too fast or too slowly. And that's how you take blood pressure.